You can start, ma'am.
Yeah. Very good afternoon, everyone. I'm Dr. Radhika, Clinical Head Fertility Specialist, Oasis Fertility from Vizag branch. సో ఈ రోజు మనం ట్యూబర్క్లోసిస్ అనేది ఇన్ఫర్టిలిటీ ఎలా కాజ్ చేస్తుంది అనేది మనం తెలుసుకుందాం. సో హౌ డస్ దిస్ ట్యూబర్క్లోసిస్ కాజ్ ఇన్ఫర్టిలిటీ? సో ఇది మనం చూసుకుంటే ట్యూబర్క్లోసిస్ అనేది ఎవ్రీ మంత్ చాలా మందికి మనకు కామన్ గా తెలిసేది పల్మరీ ట్యూబర్క్లోసిస్ గురించి. అంటే ట్యూబర్క్లోసిస్ ఇన్ఫెక్షన్ ఇన్ ద లంగ్స్ లో ట్యూబర్క్లోసిస్ గురించి చాలా మందికి తెలుసు. But here, what I want to tell you is there are other areas also where this infection can occur. It is called as extrapulmonary tuberculosis. So, ఒకవేళ lungs లో tuberculosis ఉంటే ఈ ఇన్ఫెక్షన్ అనేది either through the blood or through the lymph nodes or through direct contact, అది it can spread to other organs in the body. దీంట్లో మనం ఫోకస్ చేసి ఈ రోజు మాట్లాడుకోవాల్సింది genital tuberculosis because we are focusing on fertility. I'm going to talk about how this genital tuberculosis, that is tuberculosis of the reproductive organs, how does this cause infertility. So ఇప్పుడు మనం ఇన్సిడెన్స్ ప్రకారంగా చూసుకుంటే when we are talking about extrapulmonary tuberculosis, 9% of these cases this will cause genital tuberculosis. So the other areas where tuberculosis can occur, it can happen in the brain. It is called as TB meningitis. It can occur in the spine, it can occur in the bone and also in the abdomen. అలానే సేమ్ విధంగా reproductive organs, genital organs కూడా ఈ tuberculosis అనేది it will cause infection and it will cause problems with fertility. So ఈ tuberculosis, genital tuberculosis అనేది why we should focus more because this majorly occurs in the age group of reproductive age group. అంటే usually 20 years నుంచి 45 years age group లో ఉండే వాళ్ళకి ఈ genital tuberculosis అనేది infection అనేది కామన్ గా చూస్తాం. And this age group, when you see 20 to 45 age group is the reproductive age group where most of them they plan for their pregnancy during this age group. So always genital tuberculosis are majority commonly seen at this age group people. So now why are we worried about tuberculosis? The tuberculosis అనేది in case if it is coming spreading to the genital organs and usually all the reproductive organs for both men and women. సో ఈ రోజు మనం ప్రెజెంటేషన్ లో ఈ జెనైటల్ ట్యూబర్క్లోసిస్ వల్ల ఏ ఆర్గన్స్ ఎఫెక్ట్ అవుతాయి, ఇది ఫర్టిలిటీ ఎలా కాజ్ చేస్తుంది, ఒకవేళ దీని వల్ల ఫర్టిలిటీ ఇష్యూస్ వస్తే మనం దాన్ని ఎలా ఓవర్కమ్ చేసి వాళ్ళకి ప్రెగ్నెన్సీ వచ్చేలాగా ఎలా చేయొచ్చు అనేది ఐ విల్ టాక్ టు యూ టుడే. So when we're looking into the incidence, which organs are affected first when they have genital tuberculosis in a female? If you can see this diagram here, this is the female reproductive system. So దీంట్లో మనకి ట్యూబర్క్లోసిస్ వచ్చిన వాళ్ళకి ఆర్ ఇన్సిడెన్స్ వాళ్ళకి తెలియకుండా చైల్డ్హుడ్ లో ట్యూబర్క్లోసిస్ ఉన్న వాళ్ళకి కూడా లేటర్ ఆన్ వాళ్ళకి ఫర్టిలిటీ ఇష్యూస్ అనేవి రావచ్చు. సో అలాంటి రెట్రోస్పెక్టివ్ గా మనకి ట్యూబర్క్లోసిస్ హిస్టరీ ఉంటే వాళ్ళకి ఫస్ట్ మనం చెక్ చేయాల్సింది ఫెలోపియన్ ట్యూబ్స్ బికాస్ tuberculosis infection వచ్చిన తర్వాత almost 95 to 100% of the patients, mostly tuberculosis fallopian tubes infect అయ్యేవి almost 95% వరకు ఉంటాయి. సో అంటే ఎవరికైనా tuberculosis infection ఉంటే first affect అయ్యే structure or organ in the reproductive system in a female is the fallopian tube. As you all know, fallopian tubes are very important for fertility. Fallopian tubes లోనే fertilization జరుగుతుంది, egg and sperm unite అయ్యి fertilization అనేది జరిగి embryo formation కూడా ఈ fallopian tube లో జరుగుతుంది. So in case if these fallopian tubes are not functioning well because of the prior tuberculosis infection or the current infection, this might lead to infertility problems. So the next organ, next structure in the reproductive system which is affected because of this tuberculosis history is the endometrium. So endometrium అంటే గర్భసంచి లోపల పొర. ఈ గర్భసంచి లోపల పొర ఏమవుతుంది, యూజువలీ ట్యూబర్క్లోసిస్ ఇన్ఫెక్షన్ ఉన్న వాళ్ళకి ఈ పొర పలచబడడం, థిన్ ఎండోమెట్రియం అనే ఇష్యూస్ రావడం, బ్లడ్ సప్లై సరిగ్గా వెళ్ళకపోవడం, ఎట్రోఫిక్ ఎండోమెట్రియం అంటే డ్రైగా అయిపోయి బ్లడ్ సప్లై సరిగ్గా వెళ్ళక ఎండోమెట్రియం థిన్ గా ఉండి ఇంప్లాంటేషన్ ప్రాబ్లమ్స్ అనేవి కామన్ గా చూస్తాం. So almost 50 to 60% of patients who has history of tuberculosis, the endometrial issues అనేవి మనం కామన్ గా చూస్తూ ఉంటాం. సో ఈ రెండు కారణాల వల్ల యూజువలీ ట్యూబ్స్ అండ్ ఎండోమెట్రియల్ ప్రాబ్లమ్స్ వల్ల చాలా మందికి ఈ ఇన్ఫర్టిలిటీ ఇష్యూస్ అనేవి చూస్తూ ఉంటాం ట్యూబర్క్లోసిస్ హిస్టరీ ఉన్న వాళ్ళకి. అంతేకాకుండా వి ఆల్సో సీ 20 to 30% ఆఫ్ the ovaries how they are affected because of this infection. Usually tuberculosis వచ్చిన వాళ్ళకి ovaries ఎలా ఎఫెక్ట్ అవుతాయి, when I'm sure I will show you in the previous next coming slides what will happen. And almost 5 to 15% cervix లో ఇన్ఫెక్షన్స్ చూస్తాం అండ్ వెరీ మినిమల్ గా వెజైనా ఆర్ ద మయోమెట్రియం లో ఇన్ఫెక్షన్ అనేది కామన్ గా చూస్తాం. సో మోర్ మనం ఫోకస్ చేయాల్సింది ఫెలోపియన్ ట్యూబ్స్ అండ్ ద ఎండోమెట్రియల్ లైనింగ్. So the next, how are the symptoms? How will they usually complain? యూజువలీ ట్యూబర్క్లోసిస్ హిస్టరీ పాస్ట్ లో ఉన్నా సరే వాళ్ళు అన్ఐడెంటిఫైడ్, చాలా మందికి వాళ్ళకి ట్యూబర్క్లోసిస్ ఇన్ఫెక్షన్ ఉందని కూడా తెలియకపోవచ్చు. సిమ్టమ్స్ వాళ్ళకి జెనైటల్ ట్యూబర్క్లోసిస్ ఉన్న వాళ్ళకి సిమ్టమ్స్ లైక్ లంగ్ లో ట్యూబర్క్లోసిస్ ఉన్న వాళ్ళకి మళ్ళీ దే కెనాట్ హ్యావ్, దే మైట్ నాట్ హ్యావ్ cough or the breathlessness or severe cough or loss of weight ఇవన్నీ వాళ్ళకి గ్రాస్ గా కనిపించకపోవచ్చు. బట్ sometimes they might have menstrual disturbances because ఈ ఎండోమెట్రియం ఎఫెక్ట్ అవడం వల్ల, ఎండోమెట్రియం థిన్ గా ఉండడం వల్ల వాళ్ళకి మెన్స్ట్రల్ డిస్టర్బెన్స్ రావడం, బ్లడ్ ఫ్లో అనేది తక్కువగా అవడం, మెన్స్ట్రల్ డ్యూరింగ్ ద పీరియడ్స్ బ్లడ్ ఫ్లో తక్కువగా అవడం, సమ్‌టైమ్స్ దే మైట్ హ్యావ్ అబ్డామినల్ పెయిన్. ఈ ట్యూబర్క్లోసిస్ అనేది అబ్డామిన్ లో ఉన్నా లేకపోతే జెనైటల్ ఏరియాస్ లో ట్యూబర్క్లోసిస్ ఇన్ఫెక్షన్ ఉన్న వాళ్ళకి యూజువల్లీ ద అబ్డామిన్ లో యూట్రస్ గానీ, ఫెలోపియన్ ట్యూబ్స్ గానీ, ఓవరీస్ గానీ అన్ని అతుక్కొని దే ఫార్మ్ లైక్ అ మాస్. దే ఫార్మ్ లైక్ అ ట్యూబో ఓవేరియన్ మాస్ లాగా ఫార్మ్ అయ్యి sometimes this mass might cause pain or acute abdomen for these patients, and also they will come with the symptoms of primary infertility, especially when they have this tuberculosis history. So mostly they might have irregular cycles, they might have reduced flow during their cycles, or sometimes they might have pain abdomen. And when you examine these patients, very rarely we might see vaginitis or cervical infection. But when they have these adhesions in the abdomen, or if they have this tubo-ovarian mass-like structures, మనం abdomen or pelvic examination or pervaginal examination చేస్తున్నప్పుడు they can have this tenderness, adnexal or fornical tenderness, or fixed గా ఉండడం, ఫ్రీగా పిఓడి ఫ్రీగా ఉండకుండా కొంచెం adhesions లాగా అతుకులాగా ఉండి ఫిక్స్డ్ గా ఉండడం అనేది కూడా మనం ఎగ్జామినేషన్ చూస్తున్నప్పుడు we can find these signs. So the next thing is what we have to focus here as a fertility specialist. మనం ట్యూబర్క్లోసిస్ వల్ల తనకి ఇన్ఫర్టిలిటీ వచ్చిందా, ట్యూబ్స్ ఎలా ఉన్నాయి అనేది మనం ఫస్ట్ ఫోకస్ చేసి చూడాలి. ఇన్ కేస్ సంబడి ఈస్ కమింగ్ టు అస్ విత్ కంప్లైంట్స్ ఆఫ్ ప్రైమరీ ఇన్ఫర్టిలిటీ, ప్రెగ్నెన్సీ ఒకసారి కూడా కలగలేదు, వాళ్ళకి స్పర్మ్ పారామీటర్స్ అంతా బాగున్నాయి అండ్ ఎగ్స్ ఎవ్రీ మంత్ పీరియడ్ సరిగ్గా వస్తున్నాయి కానీ ప్రెగ్నెన్సీ కలగడం లేదు, బట్ దే గివింగ్ హిస్టరీ ఆఫ్ చైల్డ్‌హుడ్ లో వాళ్ళకి ట్యూబర్క్లోసిస్ వచ్చింది అండ్ ఆల్సో ట్యూబర్క్లోసిస్ ట్రీట్మెంట్ కూడా తీసుకున్నారని చాలా మంది తర్వాత వస్తారు ప్రెగ్నెన్సీ కలగట్లేదని. అట్లాంటి వాళ్ళకి ఫస్ట్ మనం చూడాల్సింది ఫెలోపియన్ ట్యూబ్స్, అంటే హెచ్ఎస్జి అనే ట్యూబ్ టెస్ట్ చేసి ఫెలోపియన్ ట్యూబ్స్ ఎలా ఉన్నాయి, బ్లాక్ ఏమన్నా ఉందనేది మనం చూసుకోవాలి. ఎస్పెషల్లీ ఈ హెచ్ఎస్జి పిక్చర్ లో కూడా మనకి గ్రాస్ గా ట్యూబర్క్లోసిస్ ఇన్ఫెక్షన్ ఉన్న వాళ్ళకి వాట్ వీ కెన్ సీ ఇస్, వీ కెన్ సీ లైక్ అ రిజిడ్ ట్యూబ్ లాగా. Sometimes this is called as lead pipe appearance or cog wheel appearance. అలాంటి that appearance we have a beaded appearance, tubes ఫ్రీగా థిన్ గా క్లియర్ గా లేకుండా బీడెడ్ గా appearance లో ఉంటాయి. సో ఈ మనం ఎక్స్రే లో ఈ పిక్చర్ ఇట్ సెల్ఫ్ will tell us that this is because of her tuberculosis and her tubes are affected. So all these signs we can see in the HSG itself. So next thing మనం ఏం చూస్తామంటే usually tubes, if you can see in this picture, ఈ రెండు సైడ్స్ ఫెలోపియన్ ట్యూబ్స్ మనం చూసిన ఈ ట్యూబర్క్లోసిస్ హిస్టరీ వల్ల చాలా మందికి ఏమవుతుందంటే ఫిమ్బ్రియల్ బ్లాక్స్ ఉండొచ్చు. ఫిమ్బ్రియా అంటే ట్యూబ్ లో ఒక ఎడ్జ్, అంటే ద ఎడ్జ్ ఆఫ్ ద ట్యూబ్, ద distal end of the tube is called as a fimbrium. It is called as a fimbrial end. So function of this fimbrial end, if the egg is released, this fimbria has to go and catch the egg when the ovulation has occurred. So sometimes they might have this fimbrial blocks where the tube is not able to go and pick the egg after the ovulation is happening. So usually fimbrial blocks common ga choostam, and also we can see hydrosalpinx. Hydrosalpinx and if there is fluid in the fallopian tubes. Fallopian tubes lo usually egg pickup, fimbrial end egg pickup చేసిన తర్వాత when the egg goes into the fallopian tube, when the sperm is entering into the fallopian tube, fertilization will occur, and this after fertilization this embryo grows till day 5 stage. సో ఈ 5వ రోజు వరకు ఎంబ్రియో ట్యూబ్ లో పెరుగుతున్న సమయంలో ఆ ట్యూబ్ లో ఉండే స్ట్రక్చర్స్ దే విల్ ప్రొడ్యూస్ న్యూట్రియంట్స్ విచ్ హెల్ప్ ఫర్ ద ఎంబ్రియో గ్రోత్. సో ఇలాంటి ఫంక్షనాలిటీ ఆఫ్ ద ట్యూబ్స్ అంతా కూడా ఈ ట్యూబర్క్లోసిస్ history ఉన్న వాళ్ళకి, tuberculosis infection ఉన్న వాళ్ళకి the functionality of the tube will be affected. And also if we don't detect this, if we don't identify this, and when they're planning for pregnancy because of this lead pipe appearance or cord wheel appearance, they're also more prone for ectopic pregnancies. అంటే ఈ ట్యూబ్ లోనే ఎంబ్రియో ఫార్మ్ అయ్యి మళ్ళీ వెళ్ళి యూట్రస్ లోపలికి వెళ్ళి అతుక్కోవాలి. సో ఈ ట్యూబ్ లో డిస్టర్బెన్సెస్ వల్ల, ఎడిషన్స్ వల్ల ఈ ఎంబ్రియో అనేది ట్యూబ్ లోనే ఉండిపోయి అక్కడే ప్రెగ్నెన్సీ గ్రో అయ్యేదాన్ని ectopic pregnancy under that is tubal pregnancy. So that should be a caution. So somebody who's having history of tuberculosis and they conceive, we should always have a watch on where is the pregnancy, or early ga scans cheskoni, beta hcg chusకొని ectopic కాకుండా ఉండేలాగా మనం చూసుకోవాలి. In case if we identify ectopic very early, we can prevent surgery, we can give them medical management and treat the ectopic. So that is very important when we're looking into the fallopian tubes with the history of tuberculosis. Then how does it affect the uterus and the endometrium? So if you can see here, ఈ tuberculosis history ఉండే వాళ్ళకి ఏమవుతుందంటే endometrial receptivity అనేది ఎఫెక్ట్ అవుతుంది. అంటే endometrial receptivity అంటే the endometrium will have a window of implantation where it is more receptive. అంటే when you're putting an embryo during that period, the receptivity will be good and implantation rates would be higher. So ఈ receptivity అనేది sometimes would be altered because of this tuberculosis infection when it is affecting the endometrium. And also vascularity అంటే blood flow, endometrium కి వెళ్ళే blood flow అనేది కూడా కొంచెం తక్కువ అవుతుంది because of this tuberculosis infection, and that is why the endometrium, it will become avascular, atrophic, or also implantation problems కూడా వచ్చే అవకాశం ఎక్కువగా ఉంటుంది. Next, also what we can see is synecia అంటే uterus లోపల adhesions. Usually tuberculosis infection ఉండే వాళ్ళకి uterus లోపల బాగా adhesions in case when we're doing a hysteroscopy. I have seen patients with a history of tuberculosis, and when they come to you for fertility treatments, when I'm scanning them, we can see they have thin endometriums. Sometimes we can see like cystic spaces or fluid collection in the endometrium. సో ఇలాంటి వాళ్ళకి మనం హిస్ట్రోస్కోపీ చేస్తే చాలా మందికి ఈ ఎడిషన్స్ అనేవి బాగా కనిపిస్తుంది. దట్ ఇస్ ఎండోమెట్రియల్ ఎడిషన్స్ ఉంటాయి. సో అలాంటప్పుడు మనం వీ హ్యావ్ టు రిసెక్ట్ దట్ ఎడిషన్స్ రిమూవ్ చేసి, అండ్ వీ హ్యావ్ టు గివ్ దమ్ ట్రీట్మెంట్స్ టు ఇంప్రూవ్ ద బ్లడ్ ఫ్లో టు ద ఎండోమెట్రియం అండ్ ఆల్సో టు ఇంప్రూవ్ ద ఎండోమెట్రియల్ గ్రోత్ అండ్ థిక్నెస్, and also obviously treat the tuberculosis if it is an active infection. So because of this conditions, they might have failed implantation. So when we put the embryo inside, also ఈ embryo వెళ్ళి గర్భసంచి పొర లోపల అతుక్కోకుండా implantation failures కూడా మనం చూస్తాం. So mostly if we can look into the incidence here, somebody who has endometrial TB or genital TB, 60% of them the endometrium will be affected and they might have thin endometrium. So when they have a history of this, it is very important to identify and see how their endometrium is growing, and we have to give them various treatment modalities like how we can treat thin endometrium patients. So these are the pictures which shows what we can see in a HSG. The picture over here, it shows this is the uterine cavity, and these are the fallopian tubes, and this femoral end there is a block and the dye is not coming out. So here clearly we can see a femoral block, and here also we can see a tubal block in this HSG. So now I have discussed about how it is affecting the tubes and how it is affecting the endometrium. Now, how is this tuberculosis affecting the ovaries? So ovarian tuberculosis, how it is affecting the ovaries? We can see like 20 to 30% of patients with tuberculosis infection unde valki, basically they will have this adhesions and also cascation and adnexal cyst formation and defective ovarian function. So if you can see in this laparoscopy picture, you can see all this, caseous tuberculous like structures which we can see where the uterus is going and sticking to the POD. దీనివల్ల మనకి laparoscopy పెట్టి చూస్తే we can see there will be adhesions like uterus వెళ్ళి POD కతుక్కోవడం గానీ, ovarian tubes అన్ని అంత adherent గా ఉండడం గానీ ఇలా we can see in the laparoscopy. So what happens if they're adherent like this? So when the ovary is going and sticking to the tubes and everything is stuck together, usually tubal functionality అనేది సరిగ్గా ఉండదు, ట్యూబ్ వెళ్ళి ఎగ్ పిక్ చేసుకోవడం సరిగ్గా చేయదు, అండ్ ఆల్సో ఓవులేషన్, ఓవేరియన్ క్యాప్సూల్ లోంచి ఎగ్ రిలీజ్ అవ్వడం సరిగ్గా జరగకపోవచ్చు, ఓవులేషన్ సరిగ్గా అవ్వకపోవచ్చు. సో ఆల్ దిస్ విల్ కాజ్ infertility issues. And sometimes because of this tubo-ovarian mass form avadam valla, sometimes they might have acute severe abdomen pain vachi they might need emergency laparoscopy and laparotomy also. So definitely because of the tuberculosis infection, first thing they'll have tubal problems, then they'll have endometrial problems, and sometimes they might have ovulation problem, or and endometrial dysfunction is also what we are seeing. Sometimes they have chronic anovulation. Egg release avakunda chronic ga chaala rojulu varaku egg release avakunda chronic anovulation we can see. And also they might this tuberculosis infection can also cause anti-gonadotrophic effect. Ante manam iche gonadotropins, whatever injections we give to grow the egg infection wala, because of that also the ovary or the egg might not respond well, and the growth of the egg might not be very good, and sometimes they might have poor quality eggs also. And also we have seen some patients with they might have this decreased progesterone production, and because of this they might have this implantation failure. So tuberculosis infection usually they might have low pregnancy rates and higher abortion rates if all this is not identified and treated. So how do we, in females, how do we diagnose this? As I told you, we'll have to do all the HSG, tube tests and all that. And then also before, sometimes in incidentica, we can identify in patients whom we are planning for an IVF process. When we're doing this endometrial biopsies and we're doing the screening inside the endometrium, incidentally we find out this, MGIT or tuberculosis infection in the endometrium. So such patients, we have to give them anti-tuberculosis treatment completely after our treatment complete and tarvate, they should plan for pregnancy or embryo transfer. So one more thing what we have to look into here is tuberculosis not only affects the female, it will affect the male also. So male genital tuberculosis, men if they're affected with tuberculosis, what will happen to them? So they might have symptoms of, they can have painful or, painless ulcers in the scrotum or in the penile or on the penis, they can have this ulcer. Sometimes they might have loss of libido. And sometimes they might also have this erectile dysfunction. And also when they do the semen analysis, they might have oligozoospermia or also sometimes azoospermia is also noted in patients who have, past history of tuberculosis. That might mostly we are seeing here obstructive azoospermia because ఈ ట్యూబర్క్లోసిస్ ఇన్ఫెక్షన్ అనేది women లో ఎలా అయితే ఫెలోపియన్ ట్యూబ్స్ ని ఎఫెక్ట్ ఎక్కువగా చేస్తుందో even in men they might have infection to the vas deferens or they have thick cord structures and because of that they might have ejaculatory duct obstruction or epididymal infection or obstruction. This might also cause azoospermia. So mostly they are more prone for obstructive azoospermia. So men low, if they have this tuberculosis infection, we have to identify the signs. We have to examine them to see if they're having any thick cord structures, any nodular structures, any in any fistulas or any scars or ulcers in the scrotum, all this, and also hydrocele or pyocele or any scrotal swellings should be identified if there are any ulcers or abscess. So now, so in men, if they're having this obstruction, so ఒకవేళ or tuberculosis infection వల్ల వాళ్ళకి obstruction అయ్యి azoospermia వస్తాయి. So azoospermia అంటే zero sperms in the ejaculate. So if they're having zero count, then what we can do for this men? So if they have this ejaculatory duct obstruction, it means that because of the obstruction, the sperm is not coming out from the testis. So testis is functioning well అనుకుంటే మనం testis నుంచి direct గా sperms వాళ్ళకి aspirate చేయొచ్చు. It is called as testicular sperm aspiration. So with the testicular sperm aspiration, if men are they're having zero count because of this obstruction and because of the tuberculosis infection, we can do directly aspiration from the testis, take out the sperm from the testis, and we have to inject it into the wife's egg. So E process కోసం they have to undergo IVF and ICSI process if there is complete and azoospermia. So how does this tuberculosis infection usually spread? Usually చాలా మందికి మనకి లంగ్ లో ట్యూబర్క్లోసిస్ చూస్తాం. సో ఈ లంగ్ ట్యూబర్క్లోసిస్ వచ్చిన వాళ్ళకి sometimes they can have secondary infection also. That is lung నుంచి వాళ్ళకి it can spread to the genital structures, it can spread to other structures in the body. Usually it can spread through the blood or it can spread through lymph nodes or either adjacent organs, పక్కన organs లో direct spread కూడా జరగవచ్చు. So one important thing what we should identify here is if men they're having active genitourinary infection or genitourinary tuberculosis infection, the sperm they can have this infection, and if they're having because of this they can have sexually transmitted infection to the female partner. So if they're having active infection in men, with the sperm also the female can be affected. So how do you diagnose this tuberculosis? Usually tuberculosis history ఉన్న వాళ్ళకి family history of tuberculosis or if they have any history of anti-tuberculosis treatment తీసుకొని ఉన్న వాళ్ళకి కూడా we have to look into all these problems. If because of the tuberculosis వాళ్ళ tubes and effect అయ్యాయా, endometrial thickening lining ఎలా ఉంది, every month వాళ్ళకి ovulation సరిగ్గా జరుగుతుందా, sperm parameters ఎలా ఉన్నాయి. So history, if they give the history of tuberculosis, we have to focus and check all these we have to make a checklist and check what all the structures are affected and how can we identify whether they're affected or not. We'll do a general examination and also we can do a blood test to look into the ESR, and also they do a man-2 test and a chest x-ray. So as a fertility specialist, what can we identify in the scan? Say a patient gives history of tuberculosis and she comes to you for a baseline scan, she comes to you with infertility issues. So when I do a scan, commonly what we can see with this history is you can identify hydrosalpinx in the scan. So the picture what you're seeing over here is hydrosalpinx, that is called as infection in the tube, that is called as fluid collection. Fluid collection in the tubes is called as hydrosalpinx. So what happens here, because of this infection, there's a fluid collection in the tubes, and because of that, they might have fertility issues where the tubal functionality will not occur, and because of this fluid in the tube, this fluid might also travel and enter into the endometrial cavity, and also it affects implantation also. So this especially we should not miss this hydrosalpinx when you're doing scan for patients with past history of tuberculosis, to check if they're having any hydrosalpinx. In the scan, it can be identified, and also it can be identified in the HSG, hysterosalpingography. So hysterosalpingography లో usually మనం cornwall blocks చూస్తాం, లేకపోతే fimbrial blocks చూస్తాం, beaded గా tubes చూస్తాం. We can see this called rigid like tubes, or even tobacco pouch appearance. All these appearances which we are seeing in the fallopian tubes in a HSG clearly shows these are affected by tuberculosis. So here, how can we prevent this? Somebody who has tuberculosis which is identified early and treated, ఈ ట్యూబ్స్ అండ్ endometrium లో ఎఫెక్ట్ వరకు వెళ్లకుండా మనం ప్రివెంట్ చేయొచ్చు. But somebody who has not identified this tuberculosis and the damage has already occurred, then we cannot bring it back. So we should identify early and treat early before the damage occurs to the tubes, or it affects the endometrium. So if the damage has already occurred, then we cannot bring back the normal functionality of the fallopian tubes. Then we have to look into the other options. How can we get this women pregnant? So now, so when we done a HSG and we have seen this beaded appearance, we can see if there is a block or not, and also we can confirm with a laparoscopy. This is in laparoscopy, we can see with our eye directly into the pelvis to see how the tubes are, if the tubes are blocked or not, if there is any tubo-ovarian mass, that is, if the tubes, ovary, and the uterus, everything is stuck together, nothing is functioning well over there. So then what we have to do, we have to help them, give them assisted reproductive with an IVF or ICSI. We have to help them to retrieve the egg, then do an ICSI with husband's sperm, and then try to transfer into the uterus, because the functionality of the ovaries and the tubes are not very good. And then also, yes, it is always we have to do an endometrial biopsy and send it for testing to see if there is any infection in the endometrium. If the patient is having any thin endometrium, if history of tuberculosis history lekunda kuda, if the patient is coming to us with his thin endometrial issues, and she's suffering from she's having primary infertility, that is also when we have to screen for the endometrium to check if there's any tuberculosis infection, and always treat the infection and then only go for any embryo transfer, or then only plan for pregnancy. So now in this scenario, as I told you, say the woman is affected with tuberculosis and her tubes are blocked. Say she's having all adhesions in the abdomen and everything is stuck together where the functioning is not happening properly. Say she has a very thin endometrium, she's ovulating, there is no adhesions, the egg is releasing, the tubes are functioning well, but her endometrium is affected and the endometrium is very, very thin, so it's not catching up with her ovulation. Then what should we do? Or if a man is affected with tuberculosis and he's having obstructive azoospermia, that is zero counts in the sperm, then what should we do? So all these problems we can overcome by doing an IVF and ICSI process. But if the tubes are normal, say the tubes there's no block, the tubes are functioning well, if the husband's sperm parameters are good, and if she's ovulating well, we can even plan for a minor treatments like IUIs or ovulation induction time intercourse cycles. We can grow her endometrium during the IUI cycle. But if it is a very, very thin endometrium where the patient is ovulating, egg release jarugutundi కానీ egg release అయ్యే టైంకి తన endometrium catch up అవ్వట్లేదు, endometrium is very, very thin. అలాంటి situation లో ఏం చేస్తాం? So we have to prime her endometrium. We can give her thin endometrium protocols. We can also give them PRP, platelet-rich plasma installation into the endometrial cavities, or we can also do hysteroscopic PRP injection indirectly into the endometrial cavity, and we can try to improve her endometrium by giving all the vasodilators. But if we are planning for an IVF and ICSI process, in this process, we can freeze the embryos and we have enough time over here to prepare her endometrium. Usually IUI lo manku anta time undakapochu because egg release aye time ki vadan endometrium ready ga undali. But in IVF ICSI process, we have enough time. We can freeze the embryos and we can prepare her endometrium. We can give her time, grow her endometrium. Only when the endometrium is good and receptive, that is when we can transfer the embryos, and then in this way we can give her good pregnancy chances. So definitely we can treat a patient who has problem with tuberculosis and who are having infertility issues with tuberculosis. Definitely there are treatments we can help them with an IVF ICSI process, or with a thin endometrium protocols we can grow the endometrium and help in proper implantation process. So one thing, the question which few of the questions which most of the patients have is, can anti-tuberculosis drugs be taken during pregnancy? Say if she is pregnant, she's already pregnant, and then she is identified with tuberculosis, that is maybe a pulmonary tuberculosis or any other tuberculosis during pregnancy she was identified. So there are standard TB medicines which can be given during pregnancy, which they are not harmful for the baby during pregnancy, but there are few other medications which cannot be given during pregnancy that will definitely be avoided, such as streptomycin and ethylamide are not recommended for pregnant or breastfeeding. Whichever are not recommended, definitely not given during pregnancy, but there are few safe medications which they can take during pregnancy and continue their pregnancy. So can this anti-tuberculosis drug affect fertility? So sometimes, very rarely, we there are studies which had shown that this tuberculosis drugs, ATT, anti-tuberculosis drugs, they might have some effect on the ejaculate. They might have some premature ejaculation or delayed ejaculation. Some people, they have decreased, sperm issues through the motility of the sperm which affect our morphology of the sperm affect our. So when they're taking this tuberculosis treatment, usually we tell them to avoid pregnancy, and once they finish their treatment, that is when they can plan for pregnancy. So when can they plan for pregnancy? After the tuberculosis treatment. Tuberculosis treatment completes at least after 3 months or immediately after the treatment. Usually they take it for 6 months or 9 months. So treatment అయిపోయిన తర్వాత, maybe after 3 months we can start off fertility treatments for them. We can identify and see how their sperm parameters are. We can evaluate the female and see if everything is normal. If everything is normal, we can do a smaller treatment process like IUIs. If there is a problem majorly, then we have to look into other advanced techniques. Okay. So I think you have got a small idea about tuberculosis. How is tuberculosis affecting fertility, and what happens if the tuberculosis infection is there, and how can we identify and how can we treat those patients? So now let us go into the questions. If they're having any questions, let us take the questions now. Okay, the first question here is, ma'am, can we go for IVF treatment while we are using TB medicines? So usually TB medicines, I would not prefer starting IVF treatment when you are on medication. It is always better to finish the treatment and then plan for pregnancy. But if you're having severe sperm problems or any issues in the sperm, then it is better to freeze the semen samples, freeze చేసుకొని, then you can plan for your pregnancies after your tuberculosis treatment. It's always preferable that I finish the treatment and then we can start fertility treatment. The next question is, how many days gap required for taking IVF treatment after a patient undergone through TB treatment, ma'am? So after you finish your tuberculosis treatment, immediately you can come down and start your IVF treatments. But sometimes, for some patients, depending on the drugs what they've taken, sometimes we can wait for 3 months. But usually, many patients, they go for the tuberculosis treatment, they come back, and we can start off any fertility treatment soon after your tuberculosis treatment is over. TB medicine, usually it might not affect tuberculosis infertility, but there are few studies which have shown that because of this ADT drug, sometimes there might be a small alteration in the sperm parameters, and also some men might have ejaculatory or erectile dysfunctions when they're taking this tuberculosis treatment. So usually we prefer waiting till they finish their treatment and then plan for fertility. Will the baby get affected while mother has TB earlier, ma'am? Usually, the baby will not be affected. because it depends on what anti-tuberculosis treatment they're taking. It depends on what treatment and when they are taking the treatment. If they are taking, if the patients are not given a proper anti-tuberculosis treatment, then there is a chances of infection for the baby. But usually there is no transmission to the baby if the patient has proper treatment taken. Should a patient go only for IVF treatment or they can conceive naturally? Yes, it's not that all patients will need IVF treatment, because usually what I said is sometimes patients who are having tuberculosis infection, the tubes or the endometrial lining would be affected more. But if all this is not affected, if the patient has taken early tuberculosis treatment, because if the patient is not diagnosed early and the treatment is not taken early, then there might be a permanent damage to the tubes or to the endometrium. But if the treatment is taken early, there might not be a permanent damage and the patient would recover again later after the treatment, and they might conceive naturally also. So we also see patients who have tuberculosis infection, but the tubes are, functioning well and the endometrium is normal. So it doesn't mean that if they have infection, they always have to go for IVF treatment. They can also conceive naturally, but they have to evaluate themselves and see if the tubes are functioning well or if the endometrium is all good and sperm parameters are normal if they are men. How much percentage of chances are there in TB patient to conceive through IVF treatment? See, here the why if a patient is going for IVF treatment if they have tuberculosis infection in the past, the main problem is they might have tubal problem, and also the endometrial issues might be there. It's not like every patient will have thin endometrium if they have tuberculosis infection. I've also seen many patients after finishing the tuberculosis treatment, they come back after a few months or years for treatment and their endometrium is all fine. So everybody might not have issues later on also. So the conception rates would be normal, like a normal IVF patients. They will have 60% chance of pregnancy rates like a normal IVF patient. So, okay. I think, can tuberculosis cause low sperm count? Yes, tuberculosis might cause low sperm count because, as I told you, it might affect the ejaculatory duct, it can affect the vas difference, it can affect the other structures, reproductive structures in men, and this might affect the sperm parameters. So, sometimes if the treatment is taken early, if they're not having a permanent damage, maybe after the tuberculosis treatment, they might get back to the normal state, the parameters would be normal. But if it's causing a permanent damage to them, then yes, fine. Then even after the tuberculosis treatment, when they ejaculate and give the sperm parameters would be affected for such patients. So we also seen patients who had tuberculosis history and previously the sperm parameters were normal, and later on after the tuberculosis treatment, after they finished, after the infection, we have seen they had very low sperm counts or they also had azoospermia. So tuberculosis infection is sometimes might affect and grossly will affect the sperm parameters more. Okay, so I think we are done with today's questions, and thank you very much for this live session, and I'll meet you again in the next session again. If you have any doubts regarding tuberculosis or any help with fertility issues, then you can call on this helpline number and we are there to help you. Thank you very much.